Let's move on to the middle cranial fossa. This part of the middle fossa is called the Turk's saddle, no? Or sella turcica. So that depression is a space, no, occupied by the pituitary gland, or the master endocrine gland of the body. We have more openings right here in the middle cranial fossa. And because of that, if you compare which fossa at the skull base is more prone to fracture, it will be the middle cranial fossa. No? The numerous openings in this area will contribute, no, to its weakness and to its increased risk, no, for sustaining fractures. No? So let's use this side of the middle cranial fossa to identify openings. No? The opening here is called the foramen rotundum. Foramen rotundum. So it will transmit the maxillary division of the third cranial nerve. So right here, posterior and lateral to the sella turcica, this is the foramen lacerum. So lateral to the foramen lacerum, this part right here is the opening, no, for the carotid canal. So what passes through the carotid canal is your internal carotid artery. Okay, this foramen right here, that is called the foramen ovale, and it transmits the mandibular division or third division of the trigeminal nerve. Lateral to the foramen ovale, we have the foramen spinosum. So the structure passing through the foramen spinosum is the middle meningeal artery. Again, that is a branch of the maxillary artery coming from the external carotid. And the artery will course, no, along the meninges. Meninges, that's connective tissue covering for the brain, no? And it will pass the area of the tirion. So again, any traumatic blow or force applied, area of the tirion, it can lacerate. No? It can cause fractures here and lacerate and tear the middle meningeal artery, which will cause epidural intracranial bleeding or hemorrhage. No? Bleeding needs to be controlled, and the hematoma should be evacuated or removed. No? If not evacuated or removed, no, the expanding hematoma can cause pressure buildup inside the cranium, and it can push the brain. No? It can force the brain through the foramen magnum. And what happens when the pressure buildup pushes the brain, particularly the brain stem, no, through the foramen magnum? The brain stem, which contains vital structures, no, like the primary respiratory centers for the brain, no, found in the brain stem. The brain stem is pushed against this slope right here. Now this sloping part of the temporal bone, this is known as the clivus, C-L-I-V-U-S. This is known as the clivus. No? And again, increased ICP pushes the brain stem against the clivus, and important centers, no, of the stem that controls vital body functions like breathing and blood control regulation, they can be affected, no? Thus causing instant death to our patient, no? With increased ICP due to different causes, no? Intracranial, subdural or epidural bleed due to injured middle meningeal artery is just one of the possible causes.